COVID-19 and the fear around it may have gone away. But over the past few weeks, India has been rocked by cases of fever and intense coughs. People across states have been falling sick, and some have even had to be hospitalized. Last week, the Indian Council of Medical Research said these cases are linked to influenza A, the H3N2 subtype virus that causes flu. It is a respiratory viral infection that causes illness every year. This subtype of influenza A virus was discovered in 1968 in humans. This virus derives from types of protein strains of influenza A virus, hemagglutinin HA and neuraminidase NA. HA has over 18 different subtypes, each numbered from H1 to H18, while NA has 11 different subtypes, each numbered from N1 to N11. The H3N2 is a combination of the two protein strains of the influenza A virus. The symptoms for H3N2 include headaches, fever, muscle pain, cough, sneezing, cold, runny nose or congested nose, chills, sore throat, muscle and body aches, fatigue, diarrhea, vomiting, and breathlessness. So these are some of the common symptoms of H3N2 virus. Coronavirus and influenza A H3N2 are flu-like illnesses which would cause cough, fever, and sore throat. These are viral diseases which affect respiratory tract in a similar way, and the severity can vary from time to time. However, the former is much more infectious than the latter. The medical body has clarified that these symptoms are not related to seasonal flu. The cough is severe because of swelling on vocal cords and laryngitis. All age groups can be affected due to this virus, but infection mostly targets pregnant women, people aged below 15 and above 50, and causes upper respiratory infection along with fever. To prevent H3N2 influenza, it is important to take some precautionary measures like wash your hands frequently with soap and water. Regular washing of hands must be taken seriously. Use a face mask and stay away from crowded places. Refrain from touching your lips and nose. When sneezing and coughing, properly cover your mouth and nose. Keep hydrated by drinking lots of water. Since H3N2 influenza is highly contagious and can spread from person to person rapidly through droplets, here are a few things you should refrain from. Avoid giving a handshake and do not self-medicate. Only after consulting a doctor should a patient use antibiotics or any other medication. Try not to consume food when seated next to others who are sick. In addition to this, the Indian Medical Association has issued a piece of cautionary advice against the H3N2 virus and directed doctors and pharmacists to avoid the prescription of antibiotics to H3N2 patients. The IMA also said that right now people start taking antibiotics and stop it once they start feeling better. This needs to be stopped as it leads to antibiotic resistance. Whenever there will be a real use of antibiotic, they will not work due to the resistance. And antibiotics are not necessary for the majority of present cases of fever, cough, sore throat and body aches which are caused by influenza. The medical body has also advised physicians to avoid giving patients antibiotics before determining whether the ailment is bacterial because this can lead to resistance. The treatment for H3N2 entails rest, drinking lots of liquids, and taking medication as prescribed by the doctor to reduce your fever and relieve any pain. Annual flu shots for the influenza virus should be administered and taken around this time. If symptoms are severe, visiting a doctor is greatly advisable. That's all for this video. I hope you will like this information on H3N2 influenza. If so, don't forget to share it with your friends and family to spread the awareness about this virus. Take good care of yourself and your loved ones. Follow all the safety protocols. If you're someone visiting my channel for the first time, or if you are someone who has not subscribed to my channel yet, consider subscribing it to get regular updates on health and self-care. I share videos in 3 languages, Hindi, Telugu and English, so that this information reaches a wider audience without language being a barrier. Take care. See you at RiVaa Foodz.